Hi, my name is Joshua Lee Center, and for my psychology presentation, I will be talking about why Garfield the cat has major depressive disorder. Garfield exhibits a number of the very common symptoms. The most obvious one is that he is unhappy most of the day, on most days. He also has what's called ahedonia. He is unable, oftentimes, to experience pleasure or even just the joy of being alive. He has significant weight gain. Part of this is because he doesn't do much exercise or getting around, and part of it is also because one of his coping mechanisms is gorging on lasagna. He has hypersomnia. Even for a domestic cat which sleeps 16 hours a day, he sleeps a lot. It's a way of escaping the world and the pain he feels. He has fatigue, in that he does not have the mental or emotional reserves to deal with most of the small crises that occur in his life. He can also be very indecisive. While he may want to stay in his box, and he also may want to eat lasagna, he will oftentimes battle within himself between these two competing urges. With a diagnosis of major depressive disorder, we have to consider comorbidities and other possible explanations. Now, he does have some comorbidities, including anxiety. This manifests in a couple of different ways. One, has a compulsion, namely his desire to eat lasagna, and he has obsessive hatred of Mondays, which seems, at its first glance, an irrational thing for a cat to even be aware of, let alone hate. Now, we look at this diagnosis of major depressive disorder and see that it impairs him both socially and occupationally. Socially, in that it makes it so that he cannot interact in a healthy and normal way with John or Nermal or Odie or any of the other people that he comes across. Now, he doesn't exhibit any mania. There are no energetic periods, flights of fancy, abnormally upbeat behavior, and his depression cannot be explained by any sort of a schizophrenia type diagnosis. His thought pattern, while consistently negative, is not disordered or disjointed in any way. His therapy will consist of two different major routes. The first one was some form of talk therapy, either traditional psychotherapy or a cognitive behavior therapy. A cognitive behavior therapy, I believe, would be personally very helpful for him. I think that journaling would allow him to see constant, repetitive negative thoughts and all the different ways in which he chooses to obsess and focus on the negative. Also, being able to talk about where these negative thoughts come from will allow him to see that things like, say, his hatred of Mondays, which seems nonsensical on the surface, actually stems from being separated from John. It's the first day after a weekend that they've spent together that he is separated from him for a significant period of time. Now, because of his unhealthy social skills, he can't admit this to himself or anyone else. He also will benefit from taking an SSRI, which is a selective serotonin reuptake inhibitor medication. This helps increase the amount of serotonin in the brain and can help to alleviate the symptoms of depression. Common versions are Celexa, Lexapro, Paxil, and Zoloft. The therapist that he's working with would recheck him every 4 weeks to make sure primarily that he is keeping up with this regimen. If he's not, either because he's having negative side effects, or he's refusing to take the medication, or anything like that, then they would have to search for a different medication and or a more effective talk therapy. Now, this can lead to the use of polypharmacy, multiple different medications to treat his symptoms. Also, different forms of therapy, up to and including electroconvulsive therapy, transmagnetic cranial stimulation, or even the implantation of a vagus nerve stimulator. So, in conclusion, I believe that Garfield has all the important symptoms of major depressive disorder without any other comorbidities to explain his condition. He's not suffering from substance abuse, say an addiction to catnip, or anything of the sort. I also believe that he would benefit greatly from talk therapy as well as taking medication which would be appropriate for him. Thank you.